Okay, we are moving right along in the cardiovascular system. We are on to the next topic. It's heart structure. And this topic is brought to you from behind my double mask as I am in the classroom and, COVID. So anyway, we're going to get started with heart structure. So here we go. All right, so remember we talked about the heart already. We talked about it's in your thorax, which is your chest. It's between the second and the sixth rib. It's protected by the sternum, your heart protector right here, but also your ribs. It's about the size of your fist, and it weighs less than a pound, so 250 to 350 grams. It has a double layer of pericardium with some serous fluid that protects the heart. There are 3 layers in the heart wall: the endocardium, the myocardium, and the epicardium. The heart makes a fabulous lub-dub sound, and that's from valves closing. The average heart rate is between 60 and 100 beats per minute, and the sympathetic nervous system increases your heart rate, while the parasympathetic nervous system decreases your heart rate. Okay, now the septum. The septum is a divider. It is the inner wall of the heart, and it separates the left and right sides of your heart. Why is that so important? Well, it prevents the mixing of blood between the 2 sides of the heart. The right side of the heart carries deoxygenated blood. The left side of the heart carries oxygenated blood. If those 2 sides mix their blood, then what's going to happen is the blood that's distributed to the body won't have enough oxygen content in it. So this is really important. Now, side note, your blood is never blue. It's dark red. Think about if you've ever had blood drawn, it's like a deep, darker red. That's really the deoxygenated blood. Oxygenated blood looks like the blood that's bright red, like when you get a cut. Okay, so that's what it would look like on the left side. There are 2 upper chambers and 2 lower chambers in the heart. The 2 upper chambers are the atria and atrium for singular. They have relatively thin walls. Why? They don't have to pump very far. Literally, they're sitting on top of the ventricles. The atria, their job is to pump the blood to the ventricles. That's like having to walk from your bed to the dresser, okay? Not a big deal. They don't need a lot of muscle to do that. The right atrium receives blood from the body. The left atrium receives blood from the lungs. The 2 bottom chambers of the heart are called ventricles, and they have to have thicker walls because they need pumping power. So the right ventricle has to pump blood from the heart to your lungs. Okay? And the left ventricle has to pump blood from your heart to the top of your head, to the tips of your fingers, to the tips of your toes. So it needs a lot more muscle power than to pump from atrium to ventricle. Okay? So which chamber of the heart needs the thickest walls? Do you remember? It's the left ventricle. Hopefully you knew that. But why? Well, it has to pump blood to the whole body. Remember, from the top of your head to the tips of your fingers to the tips of your toes. So the left ventricle needs that pumping power. Now, heart valves. There are atrioventricular valves. The atrioventricular valves are found between the atrium and the ventricle. Now, in general, what does a valve do? Well, it allows the blood to flow in only one direction. In this case, it's from atrium to ventricle. And when these valves close, they make the lub sound, the first of the heart sounds. So there are 2 of them. The bicuspid or mitral valve is on the left side of your heart, and the tricuspid valve is on the right side. So how do you remember it? Well, bi means 2. So the bicuspid valve has 2 names. So it's bicuspid or mitral. And tricuspid, that R, tricuspid means it's on the right side. Okay. There's my little hints for you. Now the semilunar valves. Again, remember, valves allow the blood to flow in one direction only. This time it's from the ventricle through the blood vessel. And when these valves close, they make the dub sound, the second of the heart sounds. 2 of these again. The pulmonary semilunar valve is on the right side, so it's between the right ventricle and the pulmonary arteries. And then The left side is called the aortic semilunar valve, and it's between the left ventricle and the aorta. So why are heart valves so important? You can see in this little animation, you can see those valves opening and closing. They open and close, and open and close. You can see the two atrioventricular valves open and close at the same time. Same with the two semilunar valves, atrioventricular valves, then semilunar valves. So why? Well, they open and close to prevent the backflow of blood, which is important again because we want to keep blood from mixing. Also, we want the heart to pump effectively. Ventricular valves. Dub or DUP, which sometimes you'll see, is the semilunar valves closing. So blood flow in the heart. The heart on the right side distributes deoxygenated blood. Remember, blood is never blue. It's that dark red when it lacks oxygen. And here's the blood flow. So it's going to go from the body, and it's going to come into the right atrium through the superior and inferior vena cava. It's going to go into the right atrium. Then it's going to go through the tricuspid valve into the right ventricle, and then through the pulmonary semilunar valve to the lungs using the pulmonary arteries. So, right atrium, tricuspid valve. Right ventricle, semilunar valve, lungs. And then the left side, we have oxygen-rich blood, oxygenated blood coming back from the lungs. So it's going to go into the left atrium, and it's coming back to the heart through pulmonary veins. And it's going to go left atrium, bicuspid or mitral valve, left ventricle, through the aortic semilunar valve, to the body through the aorta. So again, left atrium, bicuspid or mitral valve, left ventricle, through the aortic semilunar valve, aorta to the body. Your heart rate is measured in beats per minute. Remember, 60 to 100 is normal beats per minute, but you can see from this chart that it's relative to your age as well. Newborns, babies, and children tend to have higher heart rates, and older people tend to have lower than children, but athletes have the lowest heart rates because their hearts have been exercised and trained to pump more effectively. But there are many things that can change your heart rate. Hormones, stress, pain, sympathetic and parasympathetic. Sympathetic and parasympathetic. Your age, your fitness level, medications, diet, medical conditions, a whole lot of things can affect your heart rate. Also, if you get scared, right? That's part of your sympathetic nervous system. The cardiac output is the amount of blood the heart pumps in 1 minute. Basically, you measure the amount of blood that's flowing out of the left ventricle, and then you count your heart rate. And that's going to give you your cardiac output. You're going to multiply those numbers. Normal adults, it should be between 4 and 8 liters of blood per minute. Okay? If you are an Olympic athlete or a well-trained athlete, you're going to be way at the higher end and way above 8. Okay? Because your heart is going to be trained to pump more effectively. Blood pressure. Normal blood pressure is about 120 or 80. So what are those two numbers mean? Well, the top number is systolic blood pressure. So that means, well, first of all, what does the pressure mean? Pressure means it's the force against the walls of the artery as your blood is pumped out of the heart. Okay? So the top number is systolic. That's the maximum pressure. So as soon as your ventricles contract, that's the pressure that's measured. Okay? Diastolic, the bottom number, is the low number. So that's the least amount of pressure in your arteries. So that's going to be when the ventricles are relaxed. Right? Now, a lot of things can change your blood pressure, but you don't want it elevated too high. Not only is it stressful on your heart, it's also stressful on your arteries and can cause a lot of other issues, right? So systolic on the top is during contraction, because remember, systole means contraction. The bottom number is diastolic, because diastole means relaxation. So top number, maximum pressure, bottom number, least pressure. Okay. And there you have it, all about the heart and through mask. So